How are age and gender factors to how prone one is to developing post COVID syndrome?
Being a woman is a risk factor for the persistence and development of post COVID syndrome. As shown by the odds ratio in Figure 4, women are more at risk at developing post COVID syndrome or long COVID in comparison to men. Age is also associated with the probability of developing long COVID. As we can see in these graphs, the distribution of disease duration and age effect show that there is an increase of duration after the age of 50. In this study, only 4.5% of males in the age range of 20 to 30 developed long COVID, which was lower in comparison to the 5.6% of females in the same age range. This shows that females in the age range of 20 to 30 were also more prone to developing long COVID of 28 days.
As demonstrated by the graph, we can see that 5% of cis women older than the age of 49 experience menopausal bleeding compared to 1% of cis women in their 40s. We can also determine that menstrual cycles were greatly affected in older women in contrast to younger women.
Now that we discussed the long COVID symptoms in relationship to women, let's discuss how age affects memory and cognitive dysfunction. Now that we discussed Okay, so when we're looking at the relationship between memory and cognitive dysfunction with long COVID symptoms, we can see that long COVID affects different age population groups. Looking at the graph, there are two different categories, memory and cognition. When you look at the memory graph, the data does not demonstrate that people older than 40 face memory problems more harshly than those that are younger. If we look at the short-term memory histogram, the 70 plus age group has longer error bars showing that it's pretty much the same percentage as the younger population of 18 to 29 years. This is actually really surprising because initially it's saying that people older than 40 are more affected by memory problems than the younger population. Now, moving on to the cognitive graph, specifically in the thinking graph, the older population, 70 plus, the thinking issues are at 40% with a lower error bar that does not really overlap in comparison to the thinking issues in 18 to 29 years at around 75%. This initially means that the younger population was more affected in their cognitive abilities, in this case, thinking. The older population experienced less cognitive issues compared to the younger population, as they have lower levels of error bars that do not overlap. This is initially really surprising because it's the opposite of what we would initially think that happens to the older population.
Based on the evidence, it can be concluded that age and gender, specifically middle aged women, are known to be more vulnerable to the symptoms of post COVID syndrome. We need to focus on conducting research that is more advanced and cutting edge, and our goal should be to optimize our healthcare system to ensure better treatment and improve patient care. It's also important to increase access to information and make sure the public has exposure to a wider range of knowledge. And we should also work towards enhancing our workforce policies to create a better environment for employees.